I'm going to share about poultices today, and there are many kinds of poultices you can do. It doesn't seem to be on. Okay, what is a poultice? A poultice is like a paste, okay, something soft and moist that you spread on a cloth or on paper towel or some other material that is absorbent, and then you apply it to a person where there is need of the application, whether there's a wound or some other problems that the poultice can help to relieve pain or help to reduce inflammation or help to draw out toxins, relieve itching, muscle pain, spasm, and so on. Okay, why do we do poultices on the skin? It is because the skin is the largest organ, and it responds to both internal and external stimulation and communicates the sensations to the brain. And the skin is really the first line protection for the body. It also helps with the pores to take in and also to excrete matter. And we especially want to excrete toxins. Okay, so for today, we are going to do these 5 poultices: charcoal, potato, clay, onion, and castor oil. I want to especially spend more time on charcoal. And besides using it as a poultice, I also want to tell you that you can use it internally, especially for poisoning and for other purposes, okay? So charcoal, by charcoal, we are talking about activated charcoal. It can come in these various forms, as tablets, as capsules, or in a powder form. They are activated because they have been cleaned, steamed, and made in such a way that they have more surface area for adsorption. Okay, notice that the word is A-D-S-O-R-B, adsorb. It's not A-B or absorb, because it's not the same thing, okay? Adsorb is where it can really take in a lot more than what, say, a sponge can absorb. Okay, it can take in about, for charcoal, about 80 times more of its volume by weight, so that it can really help to remove more toxins that way. Okay, it can absorb to gas, it can absorb to liquids or solids too. Okay, so pure carbon or charcoal is never harmful, and there are no known side effects, harmful side effects, okay? If you take a lot, be sure that you drink more water because you don't want to get constipated, all right? So as it says that it does not impart anything but simply take away poisons. So it's a drawing out things from the body that are harmful to it, okay? And it said that the rule of thumb is to administer activated charcoal. For administering activated charcoal is to give too much rather than too little, okay? According to this research, and the source is studies of GI, dermal, and respiratory exposure to activated charcoal in animals demonstrated no toxicity. So there's not a worry about putting too much. Okay, why is charcoal such a wonderful remedy? First of all, it is readily available, it's simple to use, it's totally harmless, and it's highly effective. Okay? Now, by charcoal, we do not mean the kind that you use for cooking with. especially those that have already have some fuel added to it, they are not cleaned up, okay? But if really that's all that's available, the wood charcoal that's used for cooking, it may still be useful if you have nothing better, okay? But definitely we do not want to use scorched wood. Although it looks black, it is definitely not charcoal, okay? So we can use charcoal internally by drinking it, but we don't take it with meals or at mealtime because you don't want it to interfere with digestion. So we take it between meals, like 2 hours after meal, or we can also, when we take medications, wait 2 hours after medications before we take charcoal internally, okay? So it would absorb to poisons, and therefore it can be removed. Intestinal gas, when you have a lot of flatulence, it also helps to absorb to the gas, so you don't feel so full of gas. Nausea, vomiting, diarrhea, all these, for these problems, you can use charcoal internally as a drink. Basically, for adults, you drink about 1 to 2 tablespoons per glass of water. Stir it, and you just drink it up, and you can add more water, rinse it, and drink it, the rest of the residue. So activated carbon is like a mini dialysis, okay? It is good for reducing inflammation, even allergies, okay? It even lowers cholesterol, and it's useful even for peptic ulcers. Now, in the case of poisoning, whether it be accidental or otherwise, whether it be overdose of medication, what a person should do is immediately drink charcoal solution, okay? And then refill the glass and drink the sediment, and then repeat this 10 minutes later. The person should be monitored, okay, observed, see whether there's any worsening. If so, you may want to give more, or you may, if necessary, go for emergency help. Now for children, we use 1/2 the dose of the adult, okay? Children need only half the dosage. So if it's nausea and vomiting, just drink the charcoal water, and diarrhea likewise, okay? Now we come to the poultice part of using charcoal. So where there is inflammation, where there is infection, whether eye, ear, or elsewhere, lesions of the skin, okay, wounds, bee stings, poisonous, snake bites, spider bites, all these problems, you can use charcoal poultice, okay? Even for skin irritation, for bruises, it helps relieve pain too. Like if you have gum, inflamed gum, gingivitis, you can also use it. It really relieves the pain. It also can be used for people with end-stage kidney disease to help the kidneys to remove more of the toxins, since the kidneys under such circumstances are not as strong and not able to filter at the normal rate. Okay, liver too, you can use that. And for people with cancer, charcoal also helps with addressing the pain as well as reducing the swelling, the tumor, okay? We will show you how to do the poultices after the PowerPoint presentation has been done, so just wait for it, okay? So this is what we will show you later, but basically if there's any injury or bruises, you may want to wash the skin first, then you apply the poultice after you've made it, and after you have left it on for anywhere between 2 to 6 hours, you remove it, you should discard it, because it draws out the toxins and the pus, the waste matter, so you do not reuse it, okay? Basically, most poultices that draws out harmful substances, morbid matters should be discarded after use. You do not recycle them. So you may need to prepare another poultice and do it again, okay? We usually recommend that people do poultices, especially overnight, especially charcoal poultice. Okay, it can be left on when you go to bed until you wake up in the morning, then you discard it. All right. In the daytime, you can do it, then you leave it on for 6 hours, and then you discard it. So you can actually do even up to 3 times a day, right? For treating venomous bites and stings, that means they are poisonous. Okay, again, you want to wash the area if you can. Then put charcoal powder in a tub or basin or pail and immerse that part that had been bitten into that charcoal water or charcoal bath. Okay, and then after that, you dry the person and apply the poultice over it. Okay, and change the poultice after some time. It's safer since it's a poison that can go inside the body, that you not only use the charcoal externally, but you also use it internally, like drinking it. Okay, acetaminophen, that is like Panadol. Okay, this is a real case where a person overdosed on 80 tablets. Imagine, and he was rushed to the hospital. Was going to be given liver transplant, but fortunately, because the first-hand emergency treatment he was given charcoal, and the poison subsided, and the person was spared from having to have a liver transplant. So you can see how powerful charcoal is. Though it's so simple, it's not expensive, okay? And that's why in the Bible, 1 Corinthians 1:27, it says that God has chosen the foolish things of the world to put to shame the wise. And God has chosen the weak things of the world to put to shame things which are mighty. So that's for the charcoal. It's really something you want to be sure to have with you wherever you go, especially I have heard over and over again of people who have gone overseas and have had food poisoning. You know, they could easily have taken charcoal tablets or charcoal powder and drink it and help get better in a quicker way. Okay, we'll go on now to potato poultice. Okay, a potato helps to absorb and neutralize excess acids in the body. And it also is a drawer. It also draws infections from wounds, from abscess and bruises. It can reduce inflammation. Okay, it is good to use in areas like over the eyes, at joints and things like that. It's very cooling. It helps with problems like skin and soft tissue inflammation. Okay, inflamed eye, the first picture up there, that's conjunctivitis. Stye or black eyes, okay, a stye you can see in the second picture in the middle, the red part, that's called a stye. Sprains, sprains are when you twist yourself and you get inflammation response. There's swelling, there's redness, there's pain. Okay, then potato poultice will help also relieve pain, as well as it helps to remove splinters, which is a much less painful way of getting rid of splinters than having to use a tweezer and try and fish it out. Okay, so potato poultice is cooling. It helps reduce swelling. It helps against strains, joint pain, arthritis. Okay. Now, I want to say at this juncture that I'm not saying that doing these poultices is enough to take care of your ailment. if you do not change your diet or lifestyle, then, for example, if you are continuing to eat inflammatory foods, then the problem keeps coming back, right? So we must always get rid of the cause, right? If there's no cause, there's no effect. And another thing that I want you to take note of is that oftentimes these natural remedies, they don't work so fast like some very strong medication. So you may have to do them over and over again, maybe a few times a day, and from day to day, even up to weeks, sometimes even months. Okay, but you should see progress and improvement along the way. So you have to be patient, slow and steady, no harmful side effects. Okay, that's the beauty of natural remedies. If things do not improve or get better, or if they get worse, by all means, go see the doctor and go make sure you have a right diagnosis. Okay, so we will show you a potato poultice later and talk about these things that we'll be using. Basically, just grating a potato and applying it to the skin directly or in an absorbent cloth or paper towel and leaving it there secured with bandage for a few hours. It will help relieve pain and other problems. Okay, potato poultice, I will show you later. I'm trying to move this. Okay, oops, let me go back there. The third one is bentonite clay. Bentonite clay is also called Indian clay. Okay, you can buy this online, and it is another type of poultice that is also a drawer. Very good for a lot of skin infections, rashes, and other skin problems. So the clay itself is loaded with a lot of minerals, and it has a powerful absorbing and drawing effect. It draws out toxins, okay? It's antiseptic and anti-inflammatory, and it helps to promote wound healing. Okay, so these are some uses for the bentonite clay poultice. Basically, a lot of different skin diseases, rashes, bruises, acne, insect bites, burns, even eczema, psoriasis, and pain is a good drawer, reliever of pain, even nerve pain. Okay, so the next one is the onion poultice. Onion is an expectorant. That means that it helps you to break up the mucus and help to get discharge the mucus. So usually it's very good for lung congestion, whether it's bronchitis and other kind of lung diseases where there's a lot of build-up of mucus or phlegm, and you want to break up the phlegm and then let them be got rid of. So the onion is very good to use. Actually, you can use it also as broth and drink it internally. You can even do an onion enema if you want. As a poultice, it's very good, especially when you have heated it up slightly and then let it cool so that it's not too hot, and you can put it to your ear if you have an ear infection. Okay? It helps to absorb morbid matters. So you can use yellow onion or red onion, preferably not the white ones. Okay? The onion, especially when it makes you tear, that sulfur compounds in it is the active component that helps to relieve the mucus build up as well as the cough. So it's very good for colds and flus also, pneumonia also, and even for blocked sinuses. It's not moving. All right, the last one, castor oil. Castor oil is not to be taken internally, okay? It's a very thick oil, and we recommend that you buy those that are 100% organic and hexane-free, okay? Not the cheap type. And this is one poultice that's different from the other four. The other four draws out harmful substances, but this one doesn't draw out. What it does is it penetrates deeper into the body tissues and helps to soften and break up lumps or bumps or even tumors, help to shrink them. And it's very good to use together with the charcoal, especially for people with cancer. Okay, so because it does not draw out harmful substances, you can actually reuse it, recycle it. And it's very good, especially for relieving pain also, with the addition of a hot water bottle or a heating pad on top of the poultice or the compress. Okay, so what is castor oil good for? Okay, it promotes detoxification, it helps lymphatic flow, it softens, breaks up adhesions, bone spurs, carpal tunnel tendonitis, tumors, cysts, abnormal growth, relieve constipation also. So it's good to do over the abdomen for a person who is constipated. Although there are many other things that you can do for constipation. This is nice that you don't have to do surgery to remove bone spurs or for carpal tunnel tendonitis. So again, usually for poultices, we use some porous materials. I'll show you later what kind of materials you can use, so that if you don't have one, you can try and find an alternative, what is available to you, okay? And not worry that if you don't have the exact same thing, that you can't do it. You actually can make use of what is available to you. So usually because castor oil is very sticky, and if you're going to do it overnight, we recommend you cover with plastic or something that helps prevent it from leaking out. Imagine if it were to soil your bed sheet, it's very hard to clean, okay? So we have to be careful that with all the poultices, especially those done overnight, that we try to make sure they are well secured. We usually put a bandage over them. And usually when we are sleeping, we do move, we do turn, but there's no worry if it's secured well, that nothing will leak out, okay? So now we are going to go to the demonstration, right? Okay, you can hear me? Very good. Now we'll start with the charcoal poultice first. So this is how we keep charcoal, activated carbon, charcoal, same idea, okay, same thing. We need to use a screw cap bottle. So this has a screw cap here. Yeah. And this is Kathleen. I'm glad that she's here to help. She's very good at bandaging. And she's also a nurse who worked in the ER. So she is very experienced in the emergency medicine. So you'll notice that this container has another plastic lid over it. This is really to keep it well airtight and to prevent exposure of the carbon, because carbon is such a strong drawer that it absorbs readily what is around it, whether it's gas, liquid, or solid. So Looks like we are having, okay, great. So, okay, so we're going to scoop, let's say, we'll just do a small amount just for demonstration's sake. So maybe we will do 1 tablespoon of the flax seed. This flax seed has been ground into powder, so this is flax meal. 1 tablespoon of each, yes, and we'll put into a bowl. Now you'll notice that the bowl we use, it preferably is not metal bowls, okay? And we also don't use metal spoon. We prefer to use, you can use these porcelain spoons, or you can use plastic spoons or wooden spoons, okay? So now we have the flaxseed powder and the charcoal powder mixed together. We're going to add enough water to form a paste. So I'm just going to add a little, yeah, I think, is it easier to pour? Okay. She will stir as I add. Oh. Okay. As we let the flaxseed absorb the water, it will form a gel-like substance. Let me just prepare more water here. Basically, equal parts of flaxseed and the charcoal powder and a little more of the combination of them in water. Yes, so we have added enough water. As you can see, she shows you, okay, it is like a paste, right? Like a dessert, black sesame dessert. And the longer it sits, the thicker it gets. Now, there are different things you can use to spread the paste on or the poultice on. I have here a number of things you can use. This is cheesecloth. You know, cheesecloth, cotton cloth is what people use to strain things like make almond milk or some soy milk or whatever. This is cheesecloth because it's porous, all right? And then we have, this is an old pillowcase that also is good, especially for, say, you have a large area like your lungs or your abdomen, okay? You can actually put the poultice in between to hold it in place. This is, in Watson, they call it multi-purpose wipe. It's paper towel that is thicker, that is stronger, doesn't tear easily. You notice? It doesn't tear easily, okay? And this is a cotton cloth. So any of these will do, and you just spread the paste on it. But today we are going to show you another way to do it, and I'll let Kathleen explain how to do it, why it's the better way, and she will show you and explain to you. Yeah, so,
okay. Now you can use, this one is called an underpad. You can actually buy it, and that's how it comes. This is an underpad. They come in various sizes. Okay, so you need to cut it into whatever size you want, big or small, depending on the area that you want to use it for. Okay.
Yeah. So, okay.
So you can do it all the various sizes. These are all the ones that we have already done.
What have you done to the edges?
Okay, so this is a piece of raw one that hasn't been prepared yet. Okay, so I have cut the big underpad into a small into this size. Okay, so what you do is that you fold, after cutting the frill edges, right? What you do is that you just fold it in, and you take a stapler and you staple it up. Now, when you staple, you make sure that your stapler, the end is on the other side, yeah, so that it doesn't, ensure that it doesn't scratch the skin. Okay? Okay, so you did one edge already. You just do the other edge. Just a small fold will do. And so you do it for all the sides. As long as there is enough stapler to hold it, it's fine. Yeah. And for the last edge, you still do the same thing. Okay, I'll tell you the benefit of this. Okay, so you got a pad like that. But you see the staplers are all still exposed, right? So what you need is you use this. This is called micropore tape. Yeah. The best one to buy is the 3M. I'm not promoting for 3M, but their tape is really good. Okay, so what you do is that you tear one and then you paste over it. I hope you all can see. You paste over it to cover the edge, to at the same time just a little bit touching the inside of the pad. Then you fold it in. Okay? So you see you cover the stapler already so that when you put on the skin, it doesn't scratch you. All right? So if you have cut the tape a bit too long, never mind. Just take a pair of scissors and just snip off. Okay? Because none of us can be so perfect. And then you do for the other edge as well. Same thing, cover up. Okay, so now you see more imperfect already. Cut, snip it off. So same thing, you fold it in. So you cover front and back, okay? Again, you snip the extra off until you're done with all the 4 sides. Okay, so we're done with a pad. It's a very nice looking pad that you make yourself, and you cannot buy it outside. You can custom make to whatever size you want. And this is good also because you see the sides that you fold in. When there is any liquid, for example, your onion poultice or your potato poultice, they tend to come out water, right? So this pad actually absorbs it. And sometimes when you put any of that inside, when it's warm up, there'll be a lot of liquid also inside, right? So the pad actually absorbs it. And when you fold the sides in, whatever liquid actually flow back into the pad. You see or not? The pad is waterproof. So everything flows back into the pad. And then when you put on a bandage like that, it just retains there and it doesn't leak out from the sides and all this. So that is very good. And then we can make all the different sizes. There you see, big, small, long, or whatever, just to adapt to whatever place that you're using. You can even make very small ones like this.
For splinters.
Yeah, like for fingers, you want to do it, or you can wrap it this way, just do it. One piece of pad, you can do so many sizes. I think all these are made from just one pad only. All right, so you got all the different sizes. Okay, so that's how we make a pad for the poultice. Yeah.
I just want to say something else before we apply the poultice on the person. And that is, besides using flaxseed, flaxseed powder, you can also use psyllium husk. But because psyllium husk is so much more costly, I don't think it's too practical to use it. Only that it makes a very good gel that makes it easy to prepare it without getting messy. Like you can use a Ziploc bag and then put in like equal amount of psyllium husk and charcoal powder, and then add water. Let's say like 1/3 cup charcoal powder, 1/3 cup psyllium husk, put it into a Ziploc bag, and then add about 1 cup water, or you use less, and then you see, adjust as you need. Close up the Ziploc, and then just shake it, and it's mixed inside, and it doesn't spill out or get onto you. You don't have to handle it directly. And then after that, you can cut off the edges and just peel back the top part, and then the plastic on the underside is the external that keeps it from soiling you. And then you bandage that. That also can be done. But since we have this material here, so we will use this one. So I'm going to spread the paste, or you can help me do that. Spread the paste onto this material. It is absorbent. So actually the charcoal can be placed directly on the skin too, or you can put a gauze over it. Now, you do not want to put charcoal directly on skin that has cut or that is broken. I mean, because there will be a tattoo, okay, a permanent tattoo. So, but if the skin is intact, you can actually put directly on the skin. So now you have seen that the paste has been spread on it. Yeah, you can put a gauze over it. Yeah, a thin gauze. Just so that it's easier to clean later. But it is not a mask if your skin is intact. There is no cuts, so there won't be any tattoo as a result. Yeah, so she has put a piece of gauze over the charcoal poultice, and she's going to show you how she's going to bandage it. We are just going to show you on the arm, but you can apply it to wherever there is a wound or wherever there is tumor, or if it's to the joint or to the abdomen, to the chest, depending. Okay, the size, the area will be depending on where the problem lies. So, do you want to? Okay. We can use the potato poultice on your knee later. Okay.
So we do it on the arm for you, huh? Okay. So you see that?
Yes. So she is putting the charcoal poultice on the affected area, okay? And the top is where the waterproof plastic is. It's the bottom that is the absorbent side. And then she is taping the poultice down with the micropore tape. Okay, this is the kind of tape they use in the hospitals. It's okay on the skin, so it doesn't irritate. And she's putting it on all four sides. Yeah, so that it helps to ensure that the poultice doesn't flow out. And on top of that, to make it even more secure, she's going to put a bandage over it. And observe how she does the bandage, okay? Do you want to say?
So when you apply a bandage, first of all, the bandage size is important. This is only a small area. It's a small limb. Okay, it's not like the leg. So a small size, this is a 3-inch bandage. Okay, and you must use a crepe bandage because so that you have a bit of stretch, and it doesn't like it can give the person some not too tight, you know. Yeah. Okay. So what you do is that the first round you go one round to anchor the bandage. Okay. Then after that you move down. Your bandage must cover at least 1/3 of the previous one. Okay. Like that. And then when you come down, you cover 1/3 of the next one. This is called a simple bandaging. I think anybody also can do. So when you come down to here, you notice that because it's tapered, right? So if you follow the flow of the direction of the limb, you will find that your bandage will go upwards, which is just nice, because you already go one round there. You don't need to go already. Then here you can actually just cut it off. I'm not going to cut so that we can reuse the bandage. So you just do this, and then you tape the thing here. Shall you want to do it?
Okay, just the same micropore tape.
So the same micropore tape, okay? Yeah, and they all come with a clip. What you do is that with this clip, you put one here, and then you stretch it, and then you put over here. You pull it to the other side, and you always put a tape over it, because so that the clip doesn't accidentally come out and scratch you, because it is quite sharp at the edges. And what you can do is you just tape down the two sides. So normally before you start anything, you prepare all your things properly, including all your tapes ready, then you tape like that, okay? So this is how you do a bandaging. Is it too tight? Do you feel too tight? Okay, so you don't stretch it too much, otherwise you will be strangling her, it'll be too tight, right? So if it's too tight, too bad, you just have to open up and redo again. Never do it too tight, right? You just want to hold the poultice in place and not to give pressure onto the wound. And also if there's swelling, also you don't want to impede the circulation to the area. Okay? Yeah.
Okay, very good. So we are going to go now to the potato poultice, and we'll do it on her knee. The potato poultice is good for sprains and for arthritis also. Okay, so it's good for the joints like the knees or the elbows. Okay, so I'm going to take the potato. Now I've already washed this potato, and I have a grater here. Okay, I'm going to let's put this behind. So we're going to grate the potato. Yeah, you don't have to peel off the skin. Okay, just grate it. Yeah. Okay. So all you have to do is just grate the potato. Okay. Let's see. And we're going to put it on the we're going to spread it out here. Okay, you can do more. So basically, you just even it out. We can add a little more. Okay, so that's all you have to do is just layer the potato that you have grated, and we will apply it to the area that has a swelling or some pain or strain or inflammation, okay, to draw out. Or you can use it actually where there is a spur to help remove the spur, but you have to do it more than once, all right? And for potato poultice, we normally don't do it overnight. We do it for like about 2 hours or so, okay? And you can change after a while. So now you're going to see how it's going to be put onto the knee.
Okay, she has a pain on the knee, and we're going to put it on the area of the pain, the redness, the swelling. Okay, show me where's your pain. Here, okay. You need to sit forward a bit, all the way. Okay, put your knees down. Okay, then you have to pat your leg. Okay, sorry. Okay, now, so we have identified where the poultice should be. Okay, here more pain or here more pain? No, I want to know whether I'm going to put this side or this side. Here pain? No, only the top. Okay, went there. So okay. All right, so now we have the poultice there already. Now for this, what you do is that after you hold it, right, you use your hand to put the one round over the pad first. First to secure, to make sure that all this thing doesn't come out. Okay, it's done a little bit differently from the charcoal. Okay. Okay, so you go 2 rounds already on the knee, right? You know that the pad is secure, all right? So now what you do is that you're going to do a crisscross. Okay. You secure the lower side already. Now you go up. So once you're up here, behind, you go straight to this side. And then you cross again. You see or not? Go up. You go 1 round first before you go down, because you want to anchor the thing. Okay? So you can go down. Because once you go down, you're not going to come up anymore. Okay, done. See, this is called a 6-inch bandage. And you do a figure of 8 kind of bandaging. Okay, so the knee, you don't keep it straight, but you keep it bent, because this is a position where you know she will be walking around. So if you keep it straight, then it'll be too tight, then she cannot bend. Okay, so it has to be on a bend position. All right. Can you bend your leg? You see, she still can bend, right? But this is elastic, so it's stretchable, right? Can you stretch out again? Is it comfortable? Is it too tight? No. So if it's too tight, you have to redo again. So you fold in a bit. Okay, now you put these two somewhere in the middle. Actually, for this, I think, first of all, in the hospital, we never use this. We are not allowed to use. Okay? It's a hazard. But here, we can use it, but you have to take precaution. All right? So what you do is that you make sure that you always have it done on top, where you know that underneath is quite thick. All right? Because underneath, I know is the pad with the potato. All right, so yeah, it's quite thick. So what I do is, I put these two on, you can see, and then I will take my tape and tape over it to make sure that it doesn't come off at all, to scratch my patient. Okay, then you have all these corners, you just tape it down. Sorry. Okay, because it is 6-inch, you must put at least 3 pieces across. Okay? Yeah. So that's how you put for the potato poultice. All right? You will notice that I didn't tape this because the potato is falling all over. I have no chance of actually like the charcoal to go and tape it all around and all this, right? So what I have to do is that I have to hold the pet and the potato and do one first round to stabilize it first. Okay, once I stabilize it and I know that it's secure there, I can let go my hand already. Then I can do a proper, So you follow the flow of the limb. So you go anchor it at the bottom first, at the bottom of the lower side of the leg. Then after that, you go 2 rounds already. You go upwards. You go up like that. Then after that, you go round, go the other side, you go up. So it's like go up this way, go down, right? Then after that, go up again this way, So you will just follow the flow of the bandage. And then you make sure that it's not too tight for the person. Okay? Yeah. And don't forget to keep the legs bent when you do the bandaging, right? So that when they bend, it doesn't become too tight. Yeah?
Okay, so that was a very good job with the poultice, very secure. And yes, we are going to do another 3 poultices. Okay, this is the second one. We've done the potato. Now we can change. Yeah, you can take out. Okay, we're going to do the onion poultice next. So I'm going to cut up the onion. Okay, onion is really very medicinal. It's very antimicrobial. Okay, and it's very good for the lungs. Any lung problems, cough, also onion is wonderful, eaten internally as well as used as a poultice externally. So I have to chop up the onion first. So you remove the skin. This skin really sticks very tightly. You normally don't prepare the onion in advance, okay, because it will absorb what is around it in the environment. Okay, we'll just move this aside. Just have to chop up the onion. Okay, I'll just do half just for demo. So it would be good to have a sharp knife actually. Notice that I don't cut all the way through. I leave a little end here that's not cut so that it holds together. And it's easier to cut up or chop up. Okay, and then you just cut it this way into small. This knife needs to be sharpened. Okay, so I'm just cutting the onion into small sizes. Okay, let's say we have enough for a small area. Usually you will want to do it over the chest, over the lung area. Okay, so let's say we just do on a small part. Now, if you want to do it for ear infection, you would stir the onion over medium heat in a non-stick skillet.
just a short while till it kind of turns translucent. And then you also, after that, do not apply right away because it will be too hot. So you let it cool a while. Then you touch it to your own hand to see that it's not too hot before you put it over the person's ear. Again, you'll have the person lie down on the side so that the ear is, the poultice is next to the ear and is held there in that leaning position. A person can sit on pillow and lean against the poultice, the ear against the poultice. So again, all you do is just put the onion onto your material that you will use on the skin. Okay. So let's say you just spread it out. Now over time, the onion will kind of like weep or produce liquid. So it really has to be well secured, especially if you're doing it overnight. That's why using this kind of bandages is very good, since it's not going to be oozing out and soiling the clothes or the bed sheet. Okay, and so so we're just going to apply this. Okay. Yeah. So this is not cooked. And this is something that really helps people with cough. Some even do it under the sole of the feet. You can do it on your throat for sore throat, okay, over the throat. You can also do it over the chest when you have lung congestion. People, like during COVID-19 time, find this very relieving, okay? So.
Okay, I'm going to teach you a way how you're going to manage this, because first of all, the onions will fall all over because they are not stuck to each other or anything, okay? So Dinah, can you help me lift up one of the edges?
Sure.
Yeah. Okay, and what you do is that you put your tape, the sticky side up, and then you put the tape on it, okay? Then you do it again. You want slightly longer so that it will stick onto the skin. Okay. So here you go again. It's like doing a cross puzzle like that. Okay, then you do for the other sides. Okay, don't forget, the sticky side is always facing up. It's okay, can. Okay. Okay, so now you have like a pre-prepared dressing pad, okay? So all you have to do is go to the place that you want to put in. Okay, where is your pain? So you have to identify the area of pain. Okay, so she say it's here. So I'm going to put the pad this way around this time. So what I do is, there you see? Okay? Now you know why you put the tape first or not? Because it's going to fall all over the place. So I have it stuck here with the onions mostly still inside. Okay. And then because this is a knee area, for big area we use 6 inch. All right. If you use a small one, you're going to have to wrap around many times. Okay. So Auntie, can you put your leg? Can you move up a bit, bend it? Oops, oh no. Okay. So same thing, secure the dressing first. So if it's longish like that, you secure the whole place first. Okay, since I started at the bottom, now it's at the top. So I just go one more round. And then now I'm going downwards. Okay, I go up already. I'm going down. Then I do another round. I still got enough bandage to go a few rounds. Okay, this one needs to be very secure because the onion is... Okay, so be careful not to pull the elasticity too much. So are you comfortable? Is it too tight? No. Okay. So you always ask a person, because you don't want to strangulate them and make it too tight. They can tell you that. Okay. So this one, remember, the pad is up here. Okay, so I want to put the clip over the pad area. Okay, the clip will prevent the bandage from slipping out. No matter how you put the tape, right? The tape is not as secure as this thing, catching it and then preventing it from slipping open. Okay, so you cover the thing. Okay, now you paste this one. 1, 2, and the third one. This is a 6-inch, you have to put 3. Okay, so that's it.
Okay.
How are you comfortable? Can you get up to walk in it? Are you able to still walk? Okay. Doing a bandage properly is to ensure, especially it's a moving part, this is a knee area, so the person may want to walk around, like go to toilet and all this thing, right? So you will have to move the part. So if you do not bandage firm enough, it will sort of like slip and fall off, okay? And creep bandage is the one that prevents it. That means it stretch when you need to stretch, and then as you move, also, it will stay in place. Yeah? Okay.
This is, we have some more poultice. Because of the onion being, so hard to keep together, actually a good way to do it is to use the old pillowcase or use an old singlet so that you secure it within the...
Make a bag.
Yeah, like a bag, that's right, so that it doesn't fall off. And it's easier to handle that way also. And usually because we normally do it for the lungs, you need a bigger material to cover the area.
So actually, you can put on a gauze as well, fold it inside, isn't it?
Yes.
Huh? Yeah, a big, this one is not big enough. There are some gauze you can really open up quite big, and you put the onion there, then you fold in, and then you put it in the onto the pad, and then you put it on the patient, and then you do the bandaging. Just an extra step. Huh? For potato, for onion, you do the same thing.
Okay, I will be needing the bowl clean, and we're going to go on to the castor oil poultice and the clay poultice. Okay, so maybe while we're getting the bowl clean, we'll do the the castor oil poultice first. I mentioned earlier that it's best to get organic castor oil, and it says hexane-free on this bottle. You can buy this online. You can buy it like in Australia. Okay, so this is a good quality castor oil. Although we are not taking it internally, but we still don't want the skin to absorb if there's hexane or impurities in it. So, yes. So we can use it, we just, okay. Say you have a small area, and all you have to do is just pour a little of the oil. Yeah, using the spoon, I think is safer. This is a bit sticky type of oil. So just pour it onto the absorbent material. Okay. Yeah, that's enough to cover it. You don't have to go all the way to the edges. Okay. And if you want to use a paper towel or a cotton cloth, you can fold it over also. Okay. Now, one thing, especially with people who have cancer, let's say, and pain, it's good that after you put on the castor oil poultice or compress, you put a hot water bottle or a heating pad over it. Okay. Now you don't have to leave the hot water bottle or heating pad on for too long. Just about an hour or so is long enough. But the castor oil poultice itself can stay longer. So just so that it doesn't, it can be applied directly on the skin, or you can put a gauze over it also. Okay. And then just put it the same way. Are you going to do it on your finger now? Or?
Yeah, can.
Okay. So Kathleen will demonstrate how it's done. Okay, this is a smaller. So you'll see different areas, how to put it on and how to bandage it up. And then the person, it not only look neat, but it is comfortable. And notice that she talks to the person and asks questions to make sure that the person is feeling fine. Okay, we always communicate. All right, so you notice she is putting on a piece of gauze over it, and then she is preparing a smaller size bandage. Okay, so you're going to do on the finger this time.
Yes, I'm going to do on the finger. Okay, now this bandage is a bit big for a finger, but it's still okay. You can still make use of it, but they do have a smaller size that is about like 1 inch. That's easier for you to manage when you're doing for the finger. But this is also fine. You just go 1 round, 1 or 2 rounds only. Okay. So what you do is that you put the poultice after you're prepared. Okay. It's your finger. So the person for the finger is a bit different from your leg and everything. Finger, you can keep it straight, and you have to, because it's not easy. So if you put it on, say, that's where you want to put it. All right. So what you do is that you put a tape on it. Okay. You see, the tape will prevent the thing from running around, because the dressing is just to stabilize it, but if the finger move or anything, the pad will run all over the place. Okay, so because this is a big bandage, this is a 3-inch bandage, right? And actually it's just a nice fit for the finger. So you need to do is to just go 2 rounds like that. Okay, and that's all you need to do. Cut it. And fold. Okay, that's done. Can you hold? Always get the person to help you. Okay. So that's why you see it's important that you prepare your tape every time before you start. And this time you see I never prepare, so I have to ask for help. Okay, so what you do is that you tape. Okay, now for tapes, you like to fold the edge a bit, so that when you want to take out it's easier. So you always do the 2 ends first, fold. And the last one is always just to pull it all together, okay? Okay, so this one is just to hold it, and then in case any of the castor oil drain out or anything, it goes onto the bandage. All right, are you comfortable? Yes. Yeah, okay.
Okay, very good. Now we are on to the last poultice, okay? And this is the Bentonite clay. All right, you can buy this online, Bentonite clay. They actually use this in the beauty places for face mask, you know. It softens the skin, rejuvenates the skin. It's very good for skin conditions, right? Remember eczema, psoriasis, etc. So basically, you just put some of the clay into the bowl. Just a spoonful will do. I think I use. Yeah. Then we're going to add water. Yeah, just put a little water and stir, and just make sure that it forms like a paste, that there's no dry powder part. So yeah, you see that she is stirring very vigorously. Okay, we don't want any dry part. A little more. The clay will...
It's really clay.
Yeah. Yep, so that's enough water. And maybe you turn it for them to see what it looks like, the consistency.
So it's like that, a thick consistency.
Yeah, that's right. And you can apply it directly on the skin and then bandage it to secure it. Okay. Now, except for the castor oil, which is reusable, with clay poultice, just like the onion, the potato, the charcoal, you also don't recycle. After use, throw away. So you leave on between 2 to 4 hours. Okay, it is very good for pain relief also, and it's good for many kinds of skin problems, skin conditions, rashes, acne, psoriasis, eczema, etc. Okay, it helps to draw out the toxins. So basically, of the 5 poultices that we have shown you today, 4 of them draw out things, and that's why we discard them. The only one that doesn't draw out is the castor oil, and that one penetrates deep into the tissues and helps to break down adhesions and tumors and things like that, okay, growths and so on. So this clay poultice, you can do it on your face like a face mask too, or you can do it with... Okay. Pretend that she has acne, okay? She doesn't, but...
Okay, so which part of your face? Freckles.
Yeah. Okay. Oh, talking about freckles, if you want to lighten it, one of the things you can do is use turmeric. Turmeric powder. Turmeric lightens things, okay? So...
it's a bit big for the clay. Okay, so we need a very small one.
Or you want to put on the hand?
Or we put somewhere else.
Yeah, we can put on the hand.
This is already a small one. Okay, so
yeah, just apply.
So just apply it. Maybe just here, huh? Some other time. This is fun.
Easier.
Easier. No need to. You just spread it onto the affected area. Or it's like actually you put a face mask, and on the face you actually don't need to put dressing also. Yeah. Then you just put it on. Then you harden.
It will dry out. It will dry out.
Wow.
You have to let it dry out before you remove it with water. Okay.
Okay.
Yeah.
Then I'll put a gauze over it.
Yeah, sure.
Okay, so because you're going to put a bandage, so it's safer to put a cloth over it. So I just use a piece of gauze. Okay. Yeah. And for this, we can use a small 3-inch bandage. Okay. No need to anchor it or anything, but you just put the bandage over. Okay, done. Okay, basically it's just to hold the clay in place. Huh? All right, fold it in. Okay, hold. So you do tape the sides first. Okay, then you just, actually enough already. Okay.
Very good.
Okay, so how is it? Is it too tight?
No.
No, huh? No. Okay, great.
Yes. So, see, all the bandages are very neat and nice. And so they're not difficult to do, right? Basically, it's the same way pretty much. Unless it's a joint, then you may do the figure of 8. But the rest, the anchoring and then both top and bottom, just make sure that nothing falls out.
Okay.
All right.
For bandaging, the one that you go round and round is called a simple bandage. You know, you just go round and round. So you can go from bottom up, you can go from top down. All right. But yeah, the figure of 8 is just go round, go down, then after that go up again, then come down, you know. And each time you must cover at least 1/3 of the previous bandage. The reason is that so that the bandage will hold together and that it doesn't open up, because don't forget, we will move around. So every movement will cause the bandage to slip. And you want enough of the bandage to cover each other so that even if it slips a little bit, it's fine. It will still remain. Right? Otherwise, by the time your 4 hours or 8 hours is up, your bandage will probably fall apart already. Okay? Yeah.
Thank you. So this is the end.